Alright, this is just a quick video to show how I write a letter. So you can access this from anywhere within a patient's chart. So let's say that you're in this note, and I'm not sure what this note is, but here's a blank note. I'm typing my note, blah, 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 blah. And patient needs a note for work. So you just come up here under reports and you click on blank editable form, and then you can just fill in whatever you need to. So this is how it's pre-populated in mine, and this one looks messy because like John Doe doesn't have a date of birth and we don't have any, well here, we'll use Mountain Sleep Diagnostics. So let's say I'm going to send a letter to Mountain Sleep Diagnostics. He doesn't have an address, he does have his date of birth. Let's say I was going to write a nice letter so I don't want it to look ugly like that, then I can just take that stuff out and say, you know, have something bolded, to whom it may concern. Let's say he works at Mountain Sleep Diagnostics. This is to confirm that my patient, John Doe, was seen today for pneumonia. He will be cleared to return to work when he's off oxygen, or whatever your thing is, and then you just click apply. There's a little trick here, and you can change the title if you want. I usually just leave it their name. You can make things bigger or smaller. So like let's say I want to make that date really big, or let's say I want to make something really small. I can just go in and mess with it however I want. I usually don't mess with the colors though. This is something that took me a little bit to find. If you click on the signature, you can actually choose what signature to use. So there was a doctor who covered for me, so her name is in there. You can see she's been deleted, or I can click my name, or you can click no signature. Now once you click no signature, you can't find that box again. So I highly recommend not clicking that until you're sure, but what I usually do is I click my signature, then I say save form, and I say note for work. I always save these kind of things under sent faxes. I know that makes no sense, but that's what makes sense to me. You figure out what works for you. Click to save it in the portal, or in patient chart. Oh, you can see here, I clicked for them to view it in the portal if they need to print it again. I attached it to the appointment. I saved it to the tab I wanted to save it to, and I titled it. You can see it's also automatic. I didn't really tell you what I was doing, but that's what I did. I hit OK. Then you can go back and take off the signature. Yes, and then print it. Oh, I have something open. There you go. So then you can go ahead and print it on your printer the same old way, which I'm not going to do right now. And I'm not sure why this is red. My computer's never done that to me before. I think it's because I'm videoing it. So then what you can do is you can go back to the note. You can see here, here's the note for work. It's attached to this. It's also available here under sent faxes. And that's why I put this here, is like everything I don't know, I send or print, kind of, I put here. Anyhow, you can see this by this little icon. It's available in this portal. So let's say he calls and says, oh my gosh, I lost my note. I can say, just pull it up in the portal, leave me alone. Let's say he wants it to be refaxed. I can right click here and click on fax this document, and then I can just fax it to, I can just click here, send as fax, which I'm not going to do because Mountain Sleep Diagnostics would be very confused why they got that. So that's how I do notes for patients. If I do referrals, I do that differently because I like to track those under open orders. And there's a different video that shows how I do referrals, but that one shows how I do notes for like work, or that's the main one I use it for, is for work, or if they need something like for their apartment manager, or for something for their electric company saying that they have to be on CPAP, or whatever it is. That's where I do it. If you have any questions, of course, let me know.